Have you heard the term neurodiverse? Now, science is always changing, and sometimes the names change with it. But let me explain, because this is the first of its kind that I've had in a long time in the classroom. So being neurodiverse is the umbrella that falls under, and I don't know if I'm saying this correctly, and I know that our guest today, our teacher today, will share. It falls with autism, ADHD, dyslexia, Down syndrome, cognitive issues, and Tourette's. Those are different terminologies for neurodiverse. So if you love somebody that is neurodiverse, if you yourself find yourself not being able to handle your emotions, today, it's bad enough when you're trying to help a child that can't communicate effectively. But when you're the one that's trying to help them and you're the one that's throwing a tantrum along with the child, then maybe there is a need for assistance, a need for help. So today, and I'm going to have to read her credentials because she has done so much. I've known Summer Perkins for a long, long time. And so I'm so grateful or excited to share her with you. So Summer Perkins has a master's. She's a certified pediatric speech language pathologist with a master's degree in communicative disorders. And she has held roles as a clinical professor at the University of Florida and director of Pediatric Outpatient Therapy Clinic in Chicago. Summer specializes with working with children and adults who have neurodiverse conditions, and such as autism, ADHD, dyslexia, Down syndrome, and other issues that we're going to be discussing today. But she's going to help us tap into and understand the brain so that we can best manage our emotions. And so today, that's what we're going to be doing. So if you are relating already to this, make sure you get a pencil and paper so that you can start learning and growing.
And when you need a friend, you can count on me. I'll be right here waiting for you.
Hi, my name is Lily McDermott, and I am a certified life coach and the host of the Lillian McDermott Radio Show. If this is the first time you're tuning into the classroom, please know I've been waiting for you. This is a safe place where you can go when you need a friend. It is my commitment to provide natural ways to heal, and it is my mission to make awareness, responsibility, and truth a part of our everyday life. And I hope you, my listening, as well as my viewing friend, will feel empowered to embrace a new truth and live the life of your dreams. As I mentioned to you, this is a conversation we have not had in the classroom, and probably since Summer's been in the classroom way many years ago. I can't remember when, but I am grateful that she is back today because it is our sole purpose in life to give and receive love and knowledge. And I'm grateful that Summer Perkins is here to do just that. Thank you so much, Summer, for being in the classroom today.
So grateful to be here. It's great to be on your show and be able to share this information with everyone.
Absolutely. This is a conversation I haven't had here in the classroom in a long time. And I remember learning about autism with you and ADHD, and you work with people, little people from the beginning, so that this is what I remember from back then, so that the side effects or when you have these problems won't get worse. I remember you talking about how intervention was key. So share a little bit about your background and what led you to have the passion that you have today when it comes to these conditions.
Sure. So I studied at the University of Wisconsin-Madison, where I got my undergrad and master's degree from there. From there, I also was on some early intervention grants because at the time for low incidence disability, autism was considered a low incidence disability. Now our statistics are 1 in 36 children are autistic. And again, we've changed the language even since the last time that I was on the show with you. So at the time then we were using person first language, and now we're using instead that as a descriptor. So autistic child instead, disabled person. Again, it's about reclaiming the power of the word, and it's not the only thing that defines you. From there, I went to the university. Actually, from there, I went up to Chicago. I ran a clinic there as well that was specializing in social emotional language and working with autistic children. And then I went to the University of Florida, was a clinical professor there. Again, working with all different kinds of kiddos that were neurodiverse, and enjoying that. And then furthering my career at University of Central Florida, Center for Autism and Related Disabilities, where I got to work and understand even more then. And since then, I've been in private practice and continuing my knowledge and growth. And today, that's what I want to talk about, is from where I was in the beginning to now. It's the idea of shifting the paradigm of therapy, of language therapy, and the goals that we previously had to this new way of thinking about working with children that are neurodiverse children and autistic children.
That is so admirable, because we need people like you. And when I remember when I first started the show, now it's a classroom, but when I started the show back then, it was 1 in 10,000 that children were autistic. But to hear 1 in 36, have they been able to research some of the causes why that is happening?
Well, I think we've gotten better in diagnosis. So we know that boys are still diagnosed more frequently than girls. It's unclear if there's a link to that, or if it's just that typically girls display different symptoms than boys do. So sometimes we're missing that. Again, there's some that's a genetic basis. So we can see a family lineage for autistic families and within the family. Sometimes we're seeing that there's a gene that's been turned on, so in utero, or again, out of utero. We're seeing lots of different things. We're looking at different brain structures and how those are. So there's lots of different reasons. There's lots of different types. And so there's not one specific answer for that. But mostly we've just gotten better at diagnosis.
Okay. Well, what about environmental? Is there anything that can contribute towards that?
So far, all of the things that we had previously thought, those have been disproven. So I know a big one was Dr. Wakefield, and he caused quite a stir with his vaccine information, but that actually has been disproven many times. And he actually lost his license because of that research that he did, which was less than research based. It was at a child's birthday party and taking samples from his children's friends and getting people to sign off on it that actually never understood it. So that's been rescinded. So that's one thing that we know. Is there anything else that could be turning some genes on in the environment? We haven't figured that out yet.
Well, I know Andrew Wakefield, and I would encourage if you can, I would love for you to research that again. I can share with you that there was more to the story that most people understand too. And I highly respect your opinion, but I would love for you to revisit that again, if you can, if you'd like to do that, because I know him and I know how the studies came, and there were quite a few doctors that were involved as well. So, I would love to encourage you to look at that. But beside the point, it's happening. It's happening today, and it is a huge problem. And these are children that are going to become adults, and these children have parents that may not understand how to deal with these kids. And so let's start from the very beginning, because I'm sure that people that are having this love their children, but may not understand how to best support them. So what are some of these things that you can, make us aware of that could help bridge the gap?
Yeah, so what I'm talking about now is when you're looking at neurodivergence, which, like you said, is an umbrella term for lots of different things underneath this: dyslexia, dyscalculia, dysgraphia, acquired disorders, ADHD, autism, and mental health disorders are even under that. What we want to do is have this movement towards acceptance, and then also understanding that everyone has value. And what we've been doing in therapy so far has been teaching how to turn off. So from early on, we're teaching comply, comply. Don't actually understand what's going on in your body, ignore those sensations, and teaching that what you're feeling and doing is somehow wrong. So again, wanting to look at, as we now are in a society where we're all doing self-care, where we're all learning about how childhood traumas carry with us through adulthood, yet in people with disabilities, we're doing the opposite of that. So we're not trying to teach love and acceptance. We're not trying to teach boundaries. We're in fact teaching all of the opposite things. So again, compliance, we're teaching ignore your body sensations. Don't teach emotional regulation. Don't teach sensory regulation. And instead, we're teaching self-sacrifice. So ignore what you're doing yourself and comply with the adults in your environment. And I think the new shift needs to be more of that internal, let's go ahead and teach everybody should be accepted and loved. And that also, how do we regulate? How do we self-regulate? How do we teach sensory regulation, emotional regulation? And as adults in the area, also know for ourselves our own emotional regulation.
Yeah, when we were having a conversation the other day, I was saying, when as you're speaking about what you're doing with children that are or adults that are neurodiverse, I'm thinking, well, we could all learn from that too, because that disassociation and comply, did you teach that as well? Is that how you were taught in school to deal with these children? Did you see firsthand how it was affecting them, or was that something, since you were taught this is what you were doing, at what point did you realize, oh, this may not be the right thing?
Yeah, absolutely. You were taught beginning early on is make eye contact. You need to teach the kids, there needs to be a goal for eye contact. You have to be staring. First of all, that's unnatural. Second of all, when we teach the make eye contact rule, the whole reason we have eye contact with people is so that we can judge their understanding of what's going on and shift our communication style if they're not understanding us. So reading their body language, or maybe they're bored, so we need to switch topics. So that's why you would check in. That's a joint attention task. It's not an eye contact task. Mm-hmm. So from early on, I realized this doesn't make sense to me. We've also had studies where it actually has been shown brainwave wise that it's painful for autistic children and adults to make eye contact. Not for everyone. Again, none of these things are going to apply to everyone, but that has been true, that the pain sensors are being triggered. So that was an early on one that I was like, this doesn't make sense. I've always been big on self-advocacy. We need to teach from early on children to advocate for themselves, to know what it is that they need so that they can get those needs met in their environment, when maybe adults in their environment don't know that, or maybe a substitute comes in. So again, that's always been something that made sense and was important to me, but not something that most people did, and something I had to fight to get on individualized education plans, or IEPs, in schools. Mm-hmm. So now with this new, shift of understanding regulation, again, looking at how there's no way anyone can learn if you're not regulated, whether that's emotional or sensory wise. If you are not feeling regulated, you cannot learn. It's not accessible to you in that moment. You're feeling overwhelmed. You start to shut down. You start to disassociate. So it's important to teach that so that we can get to the learning part of life. I think the other thing, and we've seen now, we have so many autistic adults and other neurodivergent adults that are coming out of the system and that are telling us, this was painful for me. Here's the traumatic things that are now happening because of the way that I was treated in school, because I was told to mask. Masking means you hide things like your non-normative movement, which might be hand flapping or wanting to fidget or play with something. You're hiding your interests because maybe people would told you that those interests were weird or you shouldn't be talking about it. Trying to fit into the social norms, that's masking. So again, those are things that we now have so many adults that are telling us this is harmful to us. This has hurt us. This is impacting our relationships, and had this lasting effect on us. We're feeling burnout. We're not able to meet the demands now of society, because we've been disassociated, because we've had all these other things that told us we weren't good enough. We weren't valuable unless we fit into neurotypical society. So all of those things have made me really take stock of what are we doing and how can we change this?
Are you driving this change, or has the change come to make a difference in what people have learned? Because I know many doctors, MDs, that they come to a point where they say, this doesn't make sense. I need to find out why this naturopath or holistic clinic is helping my clients better, which is, Dr. Carlos Garcia was just in the classroom last week and was talking about this, that he, thought that he was just gonna, he had retired at an early age, and someone said, you're too young to be retired. It's going to be dangerous for you to do that, because he was living a life of excess at that point. And so he decided that they said there's a medical director position for this holistic clinic. Would you go and oversee it? And so his aha moment came when he was writing prescriptions less than the prescription that he gave before. So in getting people off and helping them titrate down. And he was actually, his idea was he was going to use this as a sitcom, and he was going to write all this stuff and go to California and create a sitcom on these crazy people. So that was his moment where he realized that as a medical doctor, he had never been trained to get people off medications. So that set off a whole level of learning for him, and many doctors and all doctors that decide to go outside of their education because it doesn't make sense anymore, they're the ones that learn there's a new way. So did that happen to you, or did someone say, hey, this is what's happening, or you heard your patients come to you now that you had in the past and now talking to you as an adult? How did it happen for you?
No, for me, it's about listening to these adults' experiences that are now telling you, hey, what I've experienced was traumatic for me.
Yeah.
And seeing how the schools operate. Again, everyone's trying to do the best that they can, but in looking at what's happening in the school system for kids, and how, a lot of times we're using physical restraints on children, and we're using seclusion. So putting them in another room. Again, 80% of kids with disabilities are the ones that are on the receiving side of those restraints or seclusion. So if you look at that, you think we're doing something that's not right here. We need to be doing a better job here. We don't need everyone to conform to things. That's the beauty of life, is our diversity. So we need to accept that. And if we don't, we need to reflect internally, what about it is bothering to us, and how do we change that? So for me, it's again about looking at what was going on with my kids and seeing their doubts and self-esteem. I don't want that to happen to them from early on, but again, because of the system that this has been built in. So, and then listening to these adults now that are advocating and saying, this didn't work for me.
Wow. And so you're bringing this change, you're creating a new way of training neurodiverse children, adults. So when it comes to self-esteem, when it comes to self-esteem, and let's say, you're saying what I heard you say before, and I want to go back, that if they have these special clicks, or if they have a unique way of behaving, Should we allow them to do this at any cost? Let's say they are screaming at the top of their lungs, and you're now at a restaurant. What is some tips that you can give the parents, the caregivers of these children, so that we don't make them feel less than?
Right. So in that situation, it's reflecting, in any of the situations, reflecting on what's going on. Is it something that you can ask the child? Obviously, in that moment, it's not going to be possible necessarily because of the state that potentially the state that they are is their emotional regulation is in. So it could be that they're dysregulated. If you think about a restaurant, you have so many sensations coming in, right? We know that autistic persons do have a different way of processing sensory information. So in a restaurant, you have smells, you have sounds, you have, so many things that it might be hot or cold. There's so many different things that are going on in a restaurant setting. Are we seeing screaming because they're dysregulated? If they're dysregulated, any sort of punishment, any sort of doing anything other than helping in that moment get regulated again is not going to do anything. If anything, it could escalate. And that's the tricky part, is in that moment, you're going to start to get dysregulated because you're going to feel, oh my God, I'm in this restaurant. Now I have this social pressure of, are people looking at me? Are they saying something about my child? Taking a step back, calming yourself so that you're in a regulated position to then help co-regulate your child is going to be important. So again, is it a sensory dysregulation? Is it an emotional dysregulation? Maybe the food that they thought they were going to eat wasn't available to them in that restaurant. Or is it simply something that's a non-normative movement that they are needing to do because of something else? So looking at the function of what's going on is going to be really important to that and talking to the person in that. And I think that's where we can get into this before that situation happens. Okay. Before that situation happens, having that toolbox of what is going to be calming, because it's going to be different for everybody, to this particular student. What is going to be calming to your child in that moment? We're so used to saying, oh, take 5 deep breaths, count to 10. That doesn't work. That doesn't always work for everyone. For me, I don't, okay.
But who's thinking about counting to 10 when you're like, ah,
Yeah, exactly.
Like,
in that moment, forget it,
Yeah, and it's us, which we don't have these issues. But can you imagine a child who has these issues or an adult who has these issues? Yeah, so keep going.
Yeah, so exactly. So it's figuring out for each person, and then having your own lingo. So it's funny, I have a 5-year-old, as you know, and we watched Turning Red. So Turning Red is this movie about a girl who turns into a panda when she experiences any kind of emotion that's overwhelming. So whether it's happy, sad, anything, she turns into a red panda. So that, for some reason, really sunk in for him. And so we say, oh, your panda is high whenever we feel like when either one of us either catches ourselves or the other person of like, hey, you might be getting dysregulated. Mm-hmm. So that then they know like, okay, so let me put one of my strategies in place. And I then can model that as a parent of like, yeah, I do feel my panda getting kind of high in this moment. Okay, well, I think I'm going to listen to music right now. That'll be calming to me. So it's great to be able to have your own lingo that makes sense for your child. Find that specific and teaching those strategies before you get to the restaurant situation.
So if you are before the restaurant situation, you say this is individualized, depending on your child or the adult that you're with, their cognitive skills and understanding you, then you can go one direction or the other. You can speak to them beforehand, maybe have a safe word. What are other things that you can do with them? Is there anything else that you can think of that can be done prior to going to the restaurant?
Sure, absolutely. Preparing expectations. What are the things that you might be going to see in this restaurant? What are you going to be experiencing? What sounds, what sensory things? Is there something we need to then bring along because it might be too loud? I've definitely brought headphones for August before. You know, when we go into certain restaurants, especially around the holidays, it was packed and so crowded and loud. And so I was like, well, just in case you might need them, here's headphones. Is it going to be a long wait? So prepping like, okay, if it's a wait, what can I bring along that then can help you with the wait? Because waiting is hard for everyone. And again, can get you dysregulated very quickly. Looking over the menu ahead of time. So, you know, what are some options that you might want on there? So it's not a pressure moment of like deciding right now because the waiter's in front of you, which is stressful. You know, it can be very stressful in a restaurant. And again, looking over even, you know, now on nowadays we have the computer, we can look at a million pictures of the restaurant. What does it look like inside? So giving some of that prep ahead of time, so we know what to expect, we know what it looks like, we can prepare for having activities or things that will be in our toolbox for calming ourselves and staying regulated. And then checking in to see, okay, how are you feeling in your body? So an important thing is interoceptive awareness. That's that ability for us to know how we're feeling, if we're feeling thirsty or hungry, our emotions within that. And something that's hard for people with something that is hard for autistic and ADHD people is having that interoceptive awareness. It's called alexithymia. So again, it's that inability to describe emotions in that moment. So instead of saying, how are you feeling? It's how does your body feel? Where are you feeling it in your body? And then being able to process, is this a painful feeling or a good feeling? And so going down to that base level before you're saying, how are you feeling? Happy, sad, overwhelmed, you know, like putting those terms to it, because again, interoceptive awareness is something that's difficult often. So looking at it from that way of where are we feeling this in our body? What does our body feel like? And that's something I think we can all use.
Without a doubt. I've seen grown-ups with no issues at all lose it and throw tantrums. They might as well wear a diaper and a bonnet and a pacifier because that's what they look like. But we don't understand that we look that way when it's happening. We go
Right.
into the tantrum and we are justified to throw the tantrum because we're so disassociated with our feelings, which is what I'm hearing you say happened at the beginning when we were coaching the child from birth to make things a lot easier for them. In fact, it created another problem. And so with that in mind, you said to me, and I heard you say loud and clear, and I've never heard this before until today, that sometimes eye-to-eye contact sets off pain receptors. I have never heard that. And I'm big on, that's how we connect with the world. The eyes are the windows of our soul. And so that's what I believe, and that's what I've been taught. Good firm handshake, eye-to-eye contact, that satisfies everybody. But I'm hearing you say it doesn't.
No, absolutely not. And also some reasons that a person might not make eye contact is also because it's more difficult for language processing. So if you're now having to take in all this visual information about a person, about their face that's constantly moving or making different gestures, their body movement, and you're having to process the language that they're using, it's more difficult. So sometimes, looking away is helpful. I do that even like if I'm listening to like podcasts, that are particularly full of information, I'll find myself looking away. And as I'm thinking and processing, and I'm like, oh yeah, I'm not like looking at the person that's speaking now, I'm listening. Or even if I'm trying to gather my thought, I'll look up and look away. So again, there's lots of reason why eye contact might not be being used, and it's not necessary. So knowing that there's going to be differences in the way that we communicate and the way that we display our physical movements, all of these things, we need to be okay with these differences and know that it's accepted and amazing that there's so many ways that we are all communicating.
Mm-hmm. But I wanna see if there's an exception here, because I
Yeah.
taught all my children to do eye contact. And,
Mhm.
and I taught them all that, you acknowledge people's presence. And so
Mhm.
that's what I taught my children, because it was a value that was instilled in me. And today I'm looking at everybody, because I believe that this is something that's important to get to the other person, to connect with the other person. Touch and feel is also very good, but not everybody can be touched, because that may be painful for them. And so, I mean, I've learned that, but eye contact. So if you are raising a child
Mhm.
and the child is having a hard time with eye contact, could that be a sign that there is neurodiversity with that child, that there may be autism, or there's a reason to probe in deeper, as opposed to, look at me, look at me, look at me. Well, because that's what we say to a 2-year-old. Look at
Sure.
mommy, because now we're connecting with the baby. So what is your advice if we're trying to connect with the child and the child is persistently having a problem with that?
Yeah, it's getting at their level. So it's being in their world rather than forcing our world on them. So okay, so instead take a moment and examine, what are they doing? What are they playing with? And how can I involve myself within that? So rather than saying, okay, no, they have to play the way that I want to play, they have to interact the way that I want to interact, go into their world. How can I insert myself and do this at this moment? And I think that's what you're looking for. And it's joint attention. So that idea of checking in with the other person to make sure that they're paying attention or understanding you or sharing a moment with you, is something that is something that can be an early predictor of whether you're autistic or not.
So
Mhm.
joint attention, what do you mean by joint attention? Communicating with a child, saying, hey, do you understand what I'm saying? Look at me, look at mommy, what does joint attention mean?
Joint attention is that idea of what we call eye contact often, but it
Mhm.
goes beyond that, in that we're wanting to do something with that. So I'm not just staring at you with my eyes. I want to, like you said, check for understanding or connect with you. I want to share a moment with you. So maybe you and I just saw something, crazy happen over to my left. So I'm going to look over and then look back at you and then look back over there. Like, did you just see that?
Yeah.
So now again, we're sharing a moment without words, just with our visual, looking back and forth. That's that joint attention. So
Okay.
you're sharing a moment with someone.
Okay, great. This is great information, because if 1 in 36 children are now diagnosed with autism, or in the spectrum, or even changing, because they changed our blood sugar levels, they changed our cholesterol levels, they changed different things in science that cause us to need medication, that cause us to have to, to me, with me, just would be to do a lifestyle change. If instead of lowering it, what we need to do is see, this is a potential, so there needs to be changes that need to be made. So with that in mind, I know, and my husband and I, Robert, we have this deal, and I will tell you what it is. And this, I guess, is a mentality maybe that I need to adjust, but we believe there's no such thing as multitasking. So if I go into his office, or he comes into my office, or he's talking to me and I'm in the middle of a text, the belief system is that unless I am looking at him, I am not listening, which is true, which is true. And so we wait, and we say, when you're done with that, I need to talk to you, because he knows that if I'm on my computer and he comes in and I'm like typing away and he comes in, and if I don't look at him,
Mhm.
he does not start speaking until I look at him, because he knows I am not hearing a word he's saying. So
Yeah.
so that's what you call joint attention, right?
Yes. Yeah. But now we know. Yeah,
I
definitely.
get it, mommy.
Yeah. But we know that that's not true for everyone. So again, these brain differences are what are amazing. You know, we all have these different brain wirings that we have. So we know that there are people, and many people, that can listen and do better listening without that eye contact. We also know lots of kids that need movement to learn, so that they're better off being able to sit on, like, a yoga ball, you know, sitting on something that gives them extra sensations, so that then they can focus. Now it looks the opposite, right? Because you're moving around, but it really actually helps their brains. So knowing that everyone's brains are different in the way that they're wired and in what works best for them. So it's finding what works best for this child and their sensory needs and their emotional profile. What is going to be the best thing for them, and teaching them then how to advocate for that for themselves as well.
Well, that all sounds great. But when the parent is frustrated, none of that, all of it goes to waste. All of it goes to waste. And so it's good that we're discussing this, because we need to see ourselves to see if we are losing it, or the child is losing it, or we're both losing it. And it's a lose-lose situation as far as I'm concerned at that point. So before we look at solutions and before we look at what else to do, I want to spend a little time talking about what's going on in the classroom, and then we're going to continue that. So, so for those of you who are new to the classroom, please go to whenyouneedafriend.com if you have not subscribed to the channel. This is a place where you can learn and grow, where we learn and grow together. If you're a subscriber, you will have all of Summer Perkins information, contact information. And so all you have to do is click on her name and it takes you to her website. Click on, you know, if there's a video or something in the past. I don't think we have a video from our first time that we communicated with one another in the show, but if there were, I can put it there as well. So just so that you know that everything has a hyperlink, so make sure you subscribe to to whenyouneedafriend.com. While you're there, like and follow me on all social media, including BitChute and Odyssey and podcasts as well. We're on every podcast. We're doing so much to get this information out there. I am learning so much today. I'm excited about it because, you know, with me, my children, you know, we did the best we could with what we had. But now we have grandchildren that are part of, you know, this world that is like facing tablets, and that's the babysitter sometimes. I'm not saying for my children or grandchildren, but I see that as to me a deficit. That's my opinion. Anyway, with that in mind, go check out the classroom at whenyouneedafriend.com. Also check out my sponsors. Without my sponsors, it would be a lot harder to do the classroom. So please support them the way that they're supporting the classroom. You can also go to my Shop Now bag, and in my Shop Now bag, there's Lilly approved products, whether it's makeup or something that gets you pain-free without medication, all of it. Some of it is affiliate programs that help grow the classroom. Some of them are not. I just want you to know that there is an alternative way or an alternate choice that you can make that will make your body a lot more happy with what you're doing and giving it what it needs so that it will perform better than you think you ever thought you could be. So check out the Shop Now bag. Also, you can become an enrolled student in the classroom, whether it's $1 or $1,000 a month or a one-time donation, whatever you can give, including your time, your talent, your treasure. Sharing this video is also helping the classroom grow, because believe it or not, many of the information that we talk about in the classroom is suppressed. And so we want to make sure that people know that there's another way, that, you know, science has changed in many ways. And so what worked back then may not work right now the same way, which is what we're learning with Summer. The way when she started teaching these children, it's different than it is today. And she's learned from that. We all get to learn from one another. And that's what I love about the classroom. And one of the things I want to remind you is that on April 6th, we have the I Am the Solution. Let me get my little notebook, because the VIPs get, this was last year's notebook. The I Am the Solution period. we need to be part of the solution, which is what we're learning here today with Summer. You know, how do we not only are able to engage a child, but to engage a child so that nobody is frustrated, although some people will be frustrated, but in a way that you're more aware. So I Am the Solution Natural Health Summit is what's going to happen on April 6th, 2024. In Rockledge, Florida. So it's right around the corner. So those of you who want to come visit and you're out of town, please come do so. And if you enter code Lily, Lilly 001, you get $24 off your admission. Last year, we had a phenomenal time. We learned so much. I mean, we have Dr. Thomas Levy, Dr. Joel Furman, Dr. Jennifer Krameth, Dr. Renee Hahn. We have the people from Avasia, which we're going to be doing a class next week on Valentine's Day to learn how to love our body by being pain-free without medications. And so there's so many different ways that we can learn. There's going to be incredible vendors that will teach us right there. This is what it feels like. This is what you do. This is what you can do to help you. And so please mark your calendar, get your ticket as soon as you can, and be part of the solution. So today we have Summer Perkins in the classroom. I'm excited to have this conversation with her. It was so nice the last time I saw you at my sister's house during the holidays, to be able to see how much you've blossomed from the first time that you came into the classroom. And again, you know, meeting you when you were younger too, to see how your passion has matured. And so if anybody wanted to get a hold of you, what would be a good way to do so that would be faster?
Yeah, absolutely. People can give me a call at 407-808-8063 or email me sperk33@gmail.com. I also have social media too that I think will be posted on here. So
Absolutely.
any of those ways will work well.
Yes, and there'll also be a link for her website in the blog. So just go check it out. We're not saying the website link right now, but go check it out in the blog. Make sure you subscribe once again. So Summer, this is triggering a lot of, questioning that it's so important that we be curious about these issues. Especially if they don't go away. There's other children. There's more than autism. I have a friend who has a 40-year-old Down syndrome, beautiful young lady who, perhaps maybe they did the best they could when she was young. And now, as a 40-year-old adult, how do you change that? And doing it in a way without any help. So what is your advice to someone that has a Down syndrome child, or a child that is now an adult and is still living at home?
Yeah, so again, looking at from the perspective that person-centered planning. So looking at, are there goals that the 40-year-old has for themselves, whatever that goal may be. I work with lots of adults, and there's always some goal. I had one adult who wanted to be a YouTuber. And so then what does a YouTuber mean to you? Well, that I can post YouTube videos, because it could mean different things. So finding out, what is that definition for you? Okay, so you want to post videos. Do you know what your theme is that you want to post them for? And then, okay, so what are the skills then that need to be learned in order to achieve that goal? Everybody has desires, wants, and needs. So it's figuring out whatever those desires, wants, and needs are. And again, no judgment on them. Everybody has their own individual ones. Some people might not like some of the ones that I have for myself. Again, it's what is this person's desires, wants, and needs, and what are the skills then that need to happen to create those? And then again, in the meantime, teaching that self-advocacy, teaching boundaries, teaching all of those things are still so critically important about regulation. That's something as an adult is when I've learned that. I didn't learn that as a child. So me as an adult, I'm learning that. It's something that we can teach everyone at any point in their life. I think that's, what I would say.
And you're absolutely right, because when we were having this conversation, I'm thinking, wait a minute. I think we can all benefit from learning about our bodies and how our body feels. Many times we disassociate with our body. and we numb, and we do things that takes like there's a distraction right over here, there's a distraction over here, so that we don't feel the pain. But pain is good. Pain is an indicator that something needs attention. What
Exactly.
is that attention? What is that attention? So what is your advice for someone who's listening to you, whether they have a a neurocognitive or diversity issue, or they're fully functioning? What is your advice to tuning in, checking in with themselves?
Yeah, I think it's doing those body checks. And it could be that you're a person that initially you set your timer on your phone and you need to do it more often because it's something that you need to check in. Okay, how often am I dissociating throughout the day? And am I dissociated right in this moment? And what can I do to get myself back in? You know, there's all kinds of techniques that you learn, like putting the ice packs on your face in order to kind of shock and jolt your system back into the moment. Holding a ball and tossing it against the wall kind of again brings you back into your own body in that moment. So being able to have that self-awareness, to notice, are you disassociated in that moment, and what can you do to get back into your body, is very important.
What other tips can you give young parents or older parents with older children that are at home that they can start practicing right now?
Yeah, I definitely think it's going to be looking at the interoceptive awareness. So again, figuring out how to teach that to your child. I know we've done with my own son, a little person, and
Show that again. I want
yeah, a little person.
to.
And in there, you have the different colors, all chosen by him, of what he thinks the emotions are, and then what color they are, and then where he feels them in his body. So, again, where do you feel that feeling? And talking about then what it makes you want to do. So, I loved it for him. He felt happy in his feet, and it makes him want to dance, which is so him.
And he's a great dancer. Yes.
So it's again noticing in your own body, where do you feel them? Because it's going to be different for everybody. You know, I tend to feel things in my cheeks more or in my chest, but everybody's different in where they feel that placement. So it's knowing, where do you feel that, and what does it make you want to do within your body, and then what can we do, what is calming to you that helps you again get in that window of tolerance, that part that we want to be in, not disassociated and not too high.
Yeah, interesting that you would have that, because I have it right. And right before we met, I had to flip my page, and this is what was under it. This is something that I use for coaching as well. And it is a chakra chart, and it talks about how emotions can be trapped in your body. So this is the grown-up version of what I do, which is, it tells me that if somebody has a dis-ease, that there is an emotional component to it. I don't know if this is something that you've studied, but certainly something that I have studied, and it works every time. We know that we can start focusing there, and once they're able to release that trauma, once they're able to even talk about it and learn where the blessings are, and they start looking at it differently, and then all of a sudden their back pain goes away, or their chest pain goes away, or their migraines go away. It's amazing. So it's how nice that you're starting your son and the children and the adults that you're working with to pinpoint, because there's a lot of people today that do not know what they're
No.
feeling. So with that in mind, and this may or may not have anything to do with what you do and what you teach, but I have to ask the question. It used to be, when my kids were little, and possibly when you were a child, there were no computers really. There were some computers, but there were no phones that we could take with us. The phone was about this big and it weighed 100 pounds. But now I'm seeing 1-year-olds, I'm seeing 6 months old looking at a camera and disengaging eye contact or joint attention with their loved ones. And I believe that some of those habits are creating um, manners that are lacking in society. Can you elaborate? Is that something? What would be your takeaway from children that have I mean, we only did like 1 hour. That is it. 1 hour of television. They can watch their homework. We would play games. At the time, there was Atari or
Yeah.
whatever those. I mean, I'm aging myself here. But so what would you say could be a potential? Is there a potential concern for you when kids are spending hours and hours and hours killing, doing video games and doing that? Is there any concern for you?
Oh man. So for me, the thing that I think of always is as parents, we're doing the best we can with that. So
Absolutely.
sometimes,
I
sometimes,
totally agree. As
yeah,
I give myself butterfly kisses.
yeah. I mean, I think like, I've definitely given the iPad to August to be like, I have to get these tasks done, So again, knowing that there are gonna be times that you need to give your child that outlet so that you can get things done. And again, that's part of your own regulation.
Mhm.
Give yourself that, like you don't feel guilt for that. Don't carry that with you. I think that there are ways to build, and oftentimes there are lots of now technology so much, and there's so many programs available that are cool,
Yeah,
that can be
educational. I don't
used.
mind educational stuff,
Yeah,
Do some
yeah.
math. Yeah.
Yeah, and there's a way to engage your child within it too. So if it is something that is calming to your child, being able to sit with them and talk about it side by side. August really loves My Singing Monsters right now. Is like his thing. It's this monster game. And so then I'll make comments about it, or we'll talk about it, and we can talk about it afterward. And, then we can create activities around it with drawing pictures of monsters and everything else. So yeah, I think there's a way to engage with it. You do have to be careful to make sure that we know it's an addiction. We know it's something that can cause an addiction, and you can often have difficulties getting your child to stop the activity too. So knowing then that you need to give lots of warning time and have that. There's also tons of programs you can put on that turn it off,
Mhm.
so that you automatically, it's turned off at a certain time and they just don't have access to it.
Yeah, I like that one. I like that
Yeah.
one. No, I think that there are children that are true in the spectrum, neurodiverse spectrum, or if that's even a terminology, but there's others that haven't developed skills
Mhm.
to engage and interact. And I'm seeing that more and more because kids are allowed to play games for 8 hours. And we're not talking about an occasional where you need to get something done. I don't know. And you know what? Maybe kids played out more often. And I don't remember, using the television, although Friday nights I did, we would have movie night, and that was a great night. We'd have picnic in the living room, and we would have movie night, and I slept the whole entire time. So, but we all did the best we could with what we had. What are
Mhm.
some of the ways that we can engage our children in different ways? What are, like, I love that little, how does it feel? Put in your body, choose a color. What are other tips that you can offer?
I think it's really looking at what does your child like. And again, if it's something that's unusual or different, going with it. Because as an adult, we get to choose whatever we like. And there's adults that cosplay and, have like very specific interests, and you find your people. So as children, like let's let them engage in those things that make and bring joy. Isn't that important to everyone?
Yes.
And instead of taking it away and saying, no, you can't play because that's not typical. Let's force you to play something that you don't find joy in. No, find joy in that and find the joy with them. So figure out how to,
I like
again,
that.
enjoy and join in with them with that type of play that they're doing, or with whatever they're interested in. And exposing them to more of that, then whatever it is that is their interest.
I think that's great advice. That's great advice for all moms and dads as we're raising children. When you have a child that you've raised a certain way, and let's say they're neurodiverse, and now they're adults and they have some habits, can you change these habits with these older adults that still have the same problem, but now have this habit that you want to break?
I guess it's looking at what the habit is and why does it need to change.
Nutrition.
Again,
Nutrition.
oh, nutrition is a very important one. So
Yes.
then, yeah. So for that specific one, so nutrition, it's, I think a lot of, again, is it a sensory component to it? Is there a part that there's any sort of anxiety about trying new foods? So looking at why is it that the nutrition is the way that it is, to figure out your best approach to it. And I think a lot of times it's explaining and talking like, okay, this is why this is important. Do you think it's something that you could try because you understand that value in it? So again, yeah, everybody can change. We all can change. It's looking at what is the function of it and talking to the person and figuring out, okay, what can we do? What are the first steps? And it might, again, it could be allowing them to choose what that step is and what it looks like for them, and let go of what you need the step to be.
Well, I have loved this conversation with you, Summer, and I'm grateful that I didn't call you Susan once.
Yes.
And hello, Susan. I'm so glad that I'm sure you're very proud of your daughter. And so this is a great conversation. And I know it's going to be one of many, because this, if 1 in 10,000 when I first started 13 years ago was an issue, and now it's 1 in 36, this is important. And if our children are grown up, we now have grandchildren, and our grandchildren. I have a granddaughter that has children as well. So, these are things that, I want to be able to be a part. I want to take part of everything. My children, my grandchildren, hopefully my great-grandchildren, even though they're in Nebraska, I want to be a part of that. And if I can educate myself and how to best love that child, that's exponentially a much greater role as a grandparent or a great-grandparent that I can have. So thank you so much for bringing that awareness and doing the work that you do. Once again, her email is sperk, PERK 33@gmail.com. And you can call Summer at 407-808-8063. And just let her know that you saw her in the Lillian McDermott radio classroom and you are having some questions. And I'm so grateful to you, Susan. Now I said it.
You jinxed yourself.
That's how the brain works. That's how the brain works.
Yes.
But thank you so much, Summer, for being in the classroom. And I'm looking forward to maybe our next conversation.
Absolutely.
Awesome. And please remember, we'll be right here waiting for you worldwide at whenyouneedafriend.com. This is Lillian McDermott and Summer Perkins, wishing you love, peace, joy, and unexpected abundance. Make it the best day ever. Good job.
The opinions and advice expressed on the Lillian McDermott radio show are intended for the individual callers and guests on the program and are presented to our wider audience solely for general educational purposes. Please act responsibly and consult personally with your own medical, psychological, or nutritional